Now, those of you who aren't listening on the radio and watching the video at the moment, you might notice that I'm in a dental chair here on the showcase floor at IDF, because all my travels, they had to take care of an issue. And I have with me Dr. Keith Wood. Dr. Wood, welcome into Tomorrow. How are you, sir?
I'm doing great.
And you're a real dentist.
I actually have to tell everybody I am a real dentist, and these are my real assistants.
So you're not here by Josh as a plant to just, here, wear this and we'll fake a credential. You're a real dentist, and Nicole, among others, your real assistant here.
Yeah, I brought both of them here. I thought they'd be a big help for me here today.
Well, they are. That's what brought us into the booth. And then we went, oh, there's a doctor, too.
Not surprised.
But now we got to talk about how you are utilizing some very cool technology with Intel's help to help your practice. Tell me what's up.
So this started, the reason I'm here is I have so many patients in Folsom where there's 7,000 employees of Intel.
Isn't that a prison?
Well, there's also a prison, but I don't see those guys.
Oh, okay. So you're talking about the city of Folsom, and
California, I have a lot of patients, and one of them was actually sitting in my chair.
kind of like I am now. Very comfortable chair, by the way.
And we use a wireless technology to record the pocket depths when we do perio probings. And he thought
Wait, can we say that on the radio? Perio probing? What is that?
they measure the distance between your gums and teeth and how deep that is. And that's what we were marking wirelessly, and he thought that was pretty advanced. So he said, hey, my job with Intel is to push new technology. Try this tablet all in one and see if that can't work for you and your business.
So I'll let you describe what Nicole is showing us right now, which is apparently some dental probing or something.
We took these of you. Oh, actually, no, we didn't.
Oh, that's not me.
But this is a Dell portable all-in-one tablet, and it's very powerful. It uses the Intel's newest i7 chip. Very fast, has over 1 terabyte of memory. It's as fast as anything we needed in our practice, and it allows us to do stuff we couldn't do before in our practice. To have 2 computers going at once, before we had to have the assistant in the other operatory to access the second computer. And this, we can bring out pictures of the children to the mom who's in the waiting room. It just sped everything up.
So the Core i7 is making a big difference in your practice, but also it looks like the ability to now further explain to a patient what's going on, other than just see that old-looking X-ray up there. Well, there's your problem. They're really able to get literally a good picture of what you're recommending be done.
We tried this with a regular laptop. It just wasn't fast enough until they finally said we have a very fast i7 chip to do it all wirelessly. That allowed it to do it, that fast chip. So
the processing power is helping your patients.
We weren't able to do it before, and I told him I don't think this is going to work, but he said, no, this is very fast. It's the fastest we got, and it did.
So it pays to actually take care of the teeth of Intel employees, because look where it's bringing you into tomorrow.
I never would have thought I was at the Geek Fest here being a dentist, and so yeah, it's been a lot of fun.
And of course, you're also helping several developers that are at, of course, the developer conference to get a better grasp on what you're doing and how you're using this technology. And maybe some are offering suggestions how you can further use it, and or you're opening the eyes of some folks that can make recommendations back home.
Absolutely. Several of the clients here are part of the healthcare division of whatever business they're in. They were very interested to see how we were utilizing this in our business, and might take some part of that back to their business.
That's awesome. And where do you see this going into tomorrow? Do you see more use of this kind of technology in your practice? What else do you want it to do that it's not quite there yet?
One of the things we use this for actually is we have an intraoral scanner. It was just too much to bring out in our short time period, but
another thing we're apparently going to have to clear with the FCC now, intraoral scanner, all right.
Yeah, it allows us to scan the preparation before we put a crown on your tooth and send off that technology, over the internet to a lab who can make it and send it right back. So we don't need to put that gooey stuff in your mouth anymore.
Oh, thank God.
Yeah.
Please, I'm going to get you in touch with my dentist who's always putting the gooey stuff and choking me. So you're saying now that technology is old and we've got the new stuff, especially when you can send it to the lab and they're able to make whatever they need to make right then and there.
Well, one of the requirements was to have that fast chip, and so this portable all-in-one allowed us to do that. So yeah.
Dynamite. Well, thank you, Doctor, and Nicole, for your assistance as well. It's great to have good assistants taking care of things, and I'm glad that's not my tooth, because that one just, I don't know, looks a little strange. And Doctor, we thank you for sharing with us how you're utilizing this really cool technology here at the Intel Developers Conference.
Glad to be a help.
We're back with more as Into Tomorrow continues. I'm Dave Graveline. Hit us up at intotomorrow.com. Links to all of our guest sites and, of course, all 3 hours of this week's radio broadcast as well. Be sure to check out the highlight video where you'll see all kinds of cool stuff from the showcase show floor here at IDF. Back in San Francisco after Into Tomorrow continues on the Advanced Media Network. Now, about my other tooth hair, Doc.